A legal bid to try and stop the rollout of the Covid-19 vaccine to children is due to be heard in court this week. It comes when we're falling behind in our rollout targets for vaccinations. Let's speak to John Taylor, founder of Free the Nation, Save the Children. John, good afternoon to you. As I understand it, you're one of the organizations that is bringing this action. Just so we sort of know where we are, firstly, a vaccination for children is not mandatory, right? It's a decision made by their parents and by the children themselves.
Hi there, Stephen. Yes, thanks for inviting me. It's really nice to be here for a change. We always battle to get any recognition for alternative voices, and I certainly appreciate that. Together with the other organizations, the ACDP, the Caring Healthcare Workers Coalition, and the COVID Care Alliance, we looked at the whole question of children vaccines for quite a while, and when it was announced, we looked at the decision from SAPRA and thought that it was time that we needed to take some steps to stop children being vaccinated, either willingly or unwillingly, considering the potential for risks and adverse events, etc., and the extremely low incidence of COVID amongst that younger cohort of people worldwide.
There's extremely low incidence of smallpox among children around the world, but the vaccine gives you protection for life. Now, obviously, the vaccine research is still underway with COVID-19, but the fact is, don't we want to get our children vaccinated as early as possible against a disease which we know has killed many people around the world? Surely vaccinating children is the right thing to do.
I don't know that vaccinating children with these vaccines is the right thing to do. There's still no animal trials, and the safety is very much in doubt. It's only been out there since basically the beginning of this year in the public realm. The tried and proven formula of testing for 10, 15 years before you release something to the general population is being ignored. I think we're going to see that, particularly with the youngsters. If you look at the South African situation, currently we've got something like 90,000 people that have been recorded as COVID deaths, and we all know there's a lot of controversy about what that means. But specifically in the 10 to 19-year-olds, there are about 330 that have finally succumbed, and all of those basically were children that had severe comorbidities and multiple comorbidities in many cases.
Okay.
So they were unlikely to really escape without consequences.
John, that's not the point. The question I put to you was that we vaccinate children against diseases to protect them for life. What's the difference with COVID?
Well, I think the proof is in the pudding already out there. They're doing boosters now less than 6 months apart. So to say we protect them for life, I mean, that's completely incorrect science, incorrect statement.
But it doesn't really matter. The fact is that the principle follows. If you're getting vaccinated once and you agree to get vaccinated once, the principle must still follow. If you vaccinate every 6 months, it doesn't matter. Get vaccinated every day. If it works, and the evidence is that it does work.
Well, I think it's the same with saying if somebody's got a migraine, when you have a migraine, you take an aspirin or something like that. So, you don't necessarily take an aspirin every single day in anticipation of having a migraine.
I was making an extreme example, but my point is this. We have seen, and there must be millions of children around the world now who have been vaccinated, and the number of adults who've been vaccinated against COVID-19 must be in the billions. I mean, I'm sure it's in the billions. The fact is that vaccinations work and they protect people against COVID-19. The same will hold true for children, and on the balance of evidence, it will probably hold true for children into their adulthood. So what's the argument? Why are you bringing the case?
Again, I take issue with your statement. You say the vaccine works. It doesn't stop transmission. It doesn't stop people from having COVID. It doesn't stop them from infecting other people. it doesn't stop them from becoming ill from COVID. They now changed the definitions of vaccines. They've now made numerous alterations to what would have been acceptable science and definitions. And they're now saying that the end point is trying to reduce hospitalizations and deaths. And that was never the reason for vaccinating. And you've got many people up in arms because they went and stood in queues, got vaccinated in anticipation of being able to return to normal lives, no masks, being able to say, okay, fine, I'm now protected from COVID. I can go and fly overseas. I can book that trip for my wedding or my anniversary or a business trip or whatever. And then a couple of weeks later, they found out, hang on a second.
Sorry, John, John, I'm sorry. I'm going to put this question very directly, right? The first thing in your argument is that you say that it doesn't stop people getting COVID-19. Well, it does reduce their chances. There can be no argument about that. Certainly, we can see, if we look at what's happened in countries that are vaccinated before ours, how it brings down the death rate and severe hospitalization. The point of vaccination is to save lives. There is immense evidence for that for vaccinations for other diseases. There's immense evidence for that for COVID-19. So I'm trying to get you to make your case. Why are you against the vaccination of children when we know, when the evidence shows that vaccinations work?
The point I'm making, again, as I did at the beginning, is that the risks, we feel the risks are going to outweigh the benefits, because you have to.
And what do you base that?
And what do you base that on? And the risk to the age group.
And what do you base that on? I mean, if there's a low risk of COVID-19 for young people, fine. But what's the risk of getting the vaccine? There doesn't seem to be much of a risk.
No, we all know the reports of myocarditis and pericarditis, etc. And that the fact is that it's early days. It's too soon to know to what extent those things are going to become aggravated with time. There's no science, there's no time to give us the record to say, yes, this is a safe vaccine. You quote smallpox. That was years and years in production. Polio was years and years. Rabies was years and years. All those things. They did tests for many years. They went through all the animal trials. They eventually went through human trials. We are still doing human trials now. If you look at the Sosonqui is not actually a rollout of vaccines. Sosonqui is being done under the guise of a phase 3 trial, which means that half of those people that were supposedly vaccinated, if it was a trial, which is what they sold it to us as, half of those people got placebos and half of those healthcare workers got vaccines. So there's no justification to now roll out a booster shot to those people. Do we know whether the 50% that got the vaccine are now going to get the booster?
John, I'm afraid I'm going to have to stop you there. We are out of time. But that's firstly not how the Sosonqui trial was managed. Half the people didn't get placebos. Otherwise, we would have far more health workers dead than we have had died from COVID-19. And the first vaccinations came 200 years ago. There was not large-scale testing then, but it worked on smallpox. I am going to have to leave it there. We are out of time, I'm afraid. John Taylor is founder of Free the Nation, Save the Children. That case due to be heard in court soon.